Okay, so we start with palliative care and its relation to taking care of people in your church or people of the same faith, and you're the pastor or the nun or the priest, or you're part of the healthcare ministry. And what is pastoral care? That's the question. Now we have to get this out of the way because we'll probably end up looking all over the place for information about pastoral care. And I'm guessing, just like us doctors, nurses, or medical trainees, when somebody says pastoral care, the only thing we can think of is, well, maybe they're the people who take care of the religious stuff, like spirituality, and they have problems about when they die, do they go to heaven or hell, or they're scared or praying for people, that kind of thing, especially if you're in a country that's still very religious. Now, if you're in a country that's extremely secular, then that's not the case. Especially if you've already entered hospitals and medical institutions. In those places, you'll see that pastoral care is all sorts of things that's not religious. Actually, in particular, if you're in a very Western secular country, pastoral care, you'll see like things like mindfulness, yoga, and things like that, but definitely and certainly not Christian, Catholic, or very religious. Particular emphasis on the Christian, Protestant, Catholic, evangelical tradition, that's being taken out of those institutions. So what is pastoral care? Well, the definition would explain it all. Once you start reading about it, you'll discover certain things. One, the idea of quote unquote pastoral care is actually a very secular Western invention. We usually don't talk about this kind of pastoral care in the past, but right now, when we say that, it means someone who's not a nurse or not a doctor or a nurse aide, maybe a psychologist. You'll know why. He's supposed to be, or he or she is supposed to be doing some kind of emotional, social, or spiritual support. So the word is support and care. So it's like psychosocial, spiritual care and support, and it can apply to any culture, tradition. I mean, for the only way for it to apply to any culture and any tradition is for it to be non-religious. So it's a non-religious form of support for people experiencing all sorts of issues somewhat related to spirituality and maybe religion, but it's a non-religious form of support. And then you say, well, what the heck is that? I mean, we've always thought it was a religious form of support. It's pastoral care. Well, the problem with that is it came from the Western countries. As you know, for the past 50 to 100 years, Western medicine, almost all institutions, educational institutions, universities, medical institutions in the Western developed world are becoming more and more secular, right? So, like, you're not supposed to put religious crucifixes or images in schools. And lately, you're not supposed to put all sorts of things, religious stuff, in hospitals or in clinics, especially if you're not a religious hospital, right? And even if you're a religious hospital, because the idea is, what if somebody who's atheistic or doesn't believe in your religion enters the hospital? Then they might feel bad and they feel offended. It's a very common word right now. They might feel quote unquote offended by the artifact or the image that you place. So, you take that out. Now, if you really think about it, if you don't want them to see those kinds of little tiny images, well, what about the priest or the pastor or the nun walking around the place dressed in their usual clothes and carrying the Bible and crucifixes and other artifacts? Well, they haven't gotten to that yet in many places. But if you think about it, if they're concerned about those small tiny stuff, then probably in a few years or decades, they'll probably go after the big, very unsightly people walking around with religious garments and religious stuff, right? So, I mean, they're walking in the corridor, right? So, but anyway, we're not there yet. And so that's pastoral care. So what's the deal? Well, especially if you're dealing with people dealing with a lot of misery and suffering, and obviously those include those who are sick or very sick, especially with life-threatening illness or actually dying or terminal. And then you cannot avoid the fact that people need some form of spiritual care or pastoral care, or you cannot avoid the fact that your modern healthcare, medical care, and nursing care that's purely focused on, try to figure out what the symptoms are so we can diagnose and we can give the medication and do the procedures and stuff so they get better. It's not adequate anymore, especially if you cannot cure the patient, or especially if you cannot bring the patient back to normal or to the way he was. And people are feeling sad, and people are feeling scared and fearful. And when you hit that stage, well, you either go for a psychiatrist, psychologist, and then later on you think about pastoral care, especially if psychiatry or psychology is not working out too well. Now, sometimes pastoral care in the very secular Western sense is under the psychosocial or psychological support group. And why is that? Because from a purely non-religious secular sense, pastoral things or spiritual things are only important because they make people sad. So actually, if you look at some of the major textbooks in end-of-life care or supportive care, you'll notice something very strange and interesting. I mean, even doctors in training or nurses in training will find this very interesting. Well, if we say, well, somebody who's terminally ill and dying and, about to die, well, who would not be concerned about what happens to them when they die? Or who would not be concerned about why are they suffering, right? Who would not be miserable or distressed or confused when they look at their state of being, their terminal state or their very sick state or dying state? And when these things attack their spiritual religious sensibilities, attack their faith and beliefs, you'll be very distressed. Now, you look at the usual standard textbooks and you say, well, maybe there's a good, maybe 30%, or you'll say, well, maybe at least 5 to 10% of the entire 1,000 to 3,000 page books would be devoted to something like that, spirituality and religious concerns or belief concerns. And what you'll notice is you can't find it anywhere. I mean, it's not even a chapter, or if it was a chapter, it's a very extremely small chapter. In several editions of standard textbooks of end-of-life care, these are the books we use for the specialists, the ones who are supposed to manage it all and know the real deal and what the patient really needs, kind of specialist. Well, you look at the books or our books, and you can't find a chapter, or you might find one small chapter. In one book, actually, it's under cultural aspects of end-of-life care. So that's, religion is a cultural thing. What it implies is, well, everything here, like 80% of it is all science and clinical trials and using medications and things like that. And there's psychology and psychiatry, which are also based on studies. But, this religion and spiritual thing is just a cultural matter. So here you go. We give you 2% of the book. And then when you look through the material, well, pretty much the message is it's important because it makes people sad and depressed and things like that. And sometimes you have to consider the way they think, even if it's religious or spiritual, and fix it so that they're not distressed and sad. And that's pretty much all there is to it. Now, if you're a pastor or a priest or a nun or someone doing spiritual care, you'll go, well, that's not the most important thing. It's not important only because it makes people sad, but that's the way the very secular Western field looks at what you're doing or what you want to do when someone's sick. But what do you want to do? Well, that's actually a very important question. I shouldn't be answering that because obviously I'm not a priest or a pastor or someone doing pastoral care or spiritual care. But then that's an important question to know. The pastoral care, as far as your very innocent first year of training spiritual care provider mind is concerned, what do you want to do? Well, let me approach it from a historical perspective. Like, in the old days, if you're very sick and there's no way to make you get better real quickly, well, the thing that comes to mind as far as everyone in your community is concerned, like Romans, Greeks, pagans, or even people in the Old Testament, would be, well, you must have done something terribly wrong. You might have angered the gods, or you might have sinned terribly, or your ancestors might have sinned terribly, and that's the reason why you're in this kind of state. And there's no way of reversing it because it's the gods who willed it, or it's God's will. That's pretty much how it works. And the only thing everyone can do, or your family can do, is try to take care of you. Some of the families will do that, or some families will just kick you out of the house because obviously God or the gods have something against you and they don't want to experience the same thing, right? So now people will think twice about trying to cure you because that's going against the gods, right? The only way for you to come up with something like that is for those people to think that, well, there's other gods that can possibly help you, and they derive their capacity to try to care for you and cure you based on this other god. That's the only way. But before the 20th century, there's really not much you can do about many things. So if you're really dying, even those people who are trying to reverse the situation through the power of another god will back away and just let you be, lest they suffer the same fate or they suffer an even worse fate, right? So what changed? Well, if we're looking at Western civilization, where modern westernized medicine is coming from, then what changed is when people started believing this sentence. The sentence goes, as you did it to one of the least of these my brethren, you did it to me. And that's going to be very familiar to those who were brought up Christian or Catholic, right? So that's where that came from, and that changed everything, right? So meaning you're very sick, you're suffering a lot, you're poor, and you're dying. It's obviously the least of my brethren, right? The least of my quote unquote my brethren, and therefore you do it to Christ. You should do something. You should care, right? Especially if you're the pastor of that community or the spiritual leader or the spiritual carers of that community, you should do something. So that kind of changed, and so this started like the early centuries, of course. So what happened? Now suddenly you have institutions and groups of people who are actually taking care of very sick people, even those who are dying. Of course they can't do much because it's pre-20th century, and after that you have bigger and bigger care houses, and suddenly you have hospitals, right? So if you're dealing with Western modern medical hospitals and institutions, your Christian Catholic beliefs started it all, right? And the idea behind all these things is because the least of the brethren who are very sick and suffering so much and miserable and even dying, and nobody can do anything about it, should be cared for. Because if you don't, then that's like not caring for Christ, right? So that's the idea. So that's pretty much what you should be thinking right now. That idea hasn't changed even now. Now what has changed are the institutions that you started. Those institutions don't think that way anymore, right? So actually they feel like they should be nice to everyone, and those scriptures and ideas about Christ and crucifixes and Christian stuff and anything that can quote offend unquote people who don't believe in those things should be taken out of those care institutions. That's pretty much where we're at right now. But they still recognize the fact that people need something, especially if they're very sick and dying. So well, let's come up with a new version. That's the idea. And so the answer is, well, let's come up with a new version of it, and let's wash away this religious thing. Just something that is not religious, something that's secular, and something that might work. And so you have this modern idea of pastoral care. It's a very secular, non-religious idea. So what happens now? So that's been happening for at least the past 50 years. And so even developing countries which are non-Western but trying to look Western and modern are trying to do the same thing, even if 70 to 90% of their population is very religious. You can hear doctors talk about putting up a very holistic approach to very sick and or dying people. Like different units taking care of very sick people, and then they want a holistic approach to care, like the heart disease holistic approach, or nephrology holistic approach, or end-stage liver holistic approach, or hospice palliative care holistic approach. But then they don't want to be religious. They're secular. They don't want to be offensive to anyone, so they have this. So I've heard specialists go, well, let's do pastoral care or existential support. Existential is a better word for everyone because it doesn't say religion. It's about being. So even if you're an atheist, it might apply to you. And then they started talking about yoga, meditation, and mindfulness because they look kind of non-Christian, non-Catholic, non-religious, and that's very much all the pastoral care you're going to get. Or you might get a psychologist or a counselor walk in and then ask you about your beliefs and try to change your belief so that your belief doesn't make you miserable. So if your Christian or Catholic belief is the one making you miserable, then it has to be changed because it's causing you misery, right? And they're not going to use scriptures to change it. They're just going to convince you that maybe your belief system is wrong or is not helping you. You should change it. You have the right to change it. Empower you to change, to believe something else. Now, hopefully that's not happening in your place, but that's pretty much the trend right now. So that's pastoral care for you. Now, it's very strange because you have a community or a metropolitan area or a country where the population is very Christian or very Catholic or holds religious beliefs very dearly. But then you have these care institutions and people inside these institutions who are trying their best not to be religious. And they're taking care of those who are suffering a lot, who are very sick, and some of those are actually dying. So it's a very strange thing, but you have to be aware of it so that you understand what you need to do and what environment you're moving in, right? Actually, what happened was something very interesting. It's like a conceptual juggling act. You create a new idea, pastoral care. Of course, when you say something like that, it connotes something else, right? But then you define it differently. And the stuff that you take out or the stuff that you remove from it, and you call it pastoral ministry. And now you have something like, the religious stuff, the non-secular stuff that, we really are not into that, but there's such a thing called pastoral ministry, religious ministry. Now, what we're doing, the thing that doesn't offend anyone, that can apply to all cultures and traditions, that's the modern pastoral care. You can even put modern to give it some, well, this is modern, you're not. And so that's what it is. So when you look at the secular Western texts and it talks about end-of-life care, and then suddenly it says pastoral care, that's what you see. There's pastoral care, which is different from pastoral ministry and religious ministry. Of course, when you first hear about it, you go, what the heck is that, right? Isn't pastoral ministry pastoral care? And then they'll say, no, this is the definition of pastoral care. Same thing actually happened to hospice care. It shifted the idea of hospice care and end-of-life care. It started out with good intentions. So somebody who's really about to die, what do they really need? And obviously, the ones who started it, when it's not yet a big money-earning, prestigious, scientific, modern medicine kind of thing, well, you say, well, 50% of it all, or a good chunk of it all, would be something about their religious belief. So you cannot have end-of-life care without giving them or providing spiritual care or pastoral ministry or pastoral care in the actual, real pastoral care sense. But that was 50 to 75 years ago. Now you open up the textbook and what do you see? Well, the first order of business is to figure out what they're feeling. So we might not be able to cure them. That's not our job. But our job is to use science and research to figure out the best medication and medical procedure that we can do inside the hospital, or that we can prescribe, so that they don't throw up, or they don't feel pain, or they can sleep, or so they don't feel sad, and things like that. And the religious stuff or the belief stuff or the spiritual stuff is important, but we're not too interested in that. And probably in our very secular, non-religious minds, they're only important if the people are very sad, and the psychiatrists and the psychologists can't do anything about it. Then we'll probably call them up. Otherwise, what's the need for them? Of course, your answer to that is, there's something that's much, much more important than your worldly, objective, scientific, material, world-based, modern medical world, right? And of course, nobody will listen to you. You can talk among yourselves and it would make sense, but you talk to the modern medical community, then it won't make sense to them. But that's what you're dealing with right now. But again, just because it's more difficult for you, actually very difficult for you, it doesn't mean you shouldn't be trying to do it, because very difficult, it's not an excuse, right? As the early histories of your churches are concerned, everything started out very difficult. And yet, during those very difficult times, those were the times when the faith and beliefs were very strong, right? And you know that through your religion history and church history. And then once things get started, and then some worldly material concerns seep in and everything's quiet, then the faith and belief system gets corrupted and people get complacent. But again, as you know, based on your Christian or Catholic Christian beliefs, what happens to people who become complacent in terms of their beliefs, or whose beliefs and faith becomes corrupted? Exactly, right? Now, if we go back to the history, then so that also means another thing. For example, if a priest or a pastor or a nun or a spiritual care provider from a church has someone inside the hospital or a medical care institution who's needing a visit, sometimes you look at the hospital and you say, well, we have to ask if it's okay. We have to ask the doctors if it's okay, right? And then, of course, the question is, why can it be not okay? The only reason why it cannot be okay is if the patient or the family doesn't want to see you, right? You look at the place and you have these doctors who are trying their best to cure this person, and so maybe we have to ask their permission. We might be bothering them, and those kinds of conscious and subconscious stuff are going inside your head. And then my message to you is, you'll know if you're needed or not. And if the family and the patient asks for you, then that's all the permission you need. Even if the people inside the hospital are telling you not to go there and they don't want you because they don't think you're that important, and the only thing you're good for is if the patient is very sad and the psychiatrist and the secular psychologist cannot do anything about it, then they'll call you up. Okay, so now as far as the medico-legal considerations are concerned, well, you actually have the right to go there. All you need is the patient and the family to ask for you and to allow you to go there. They can even demand that the hospital and the doctors allow you to be there. Of course, they have to be empowered. I mean, most families and patients are also not that empowered. They also think, well, we want to see our pastor or priest or so and so, but is it okay with Dr. So and so? Now, doing this was okay several centuries ago. Why? Because, as I've said, hospitals and care institutions were run and started by the religious groups, right? Whatever you do to the least of your brethren, you do to me, right? And there's no financial or commercial or there's no other motivation to do those things except that you want to care. And the reason why you want to care for people who shouldn't be cared for several centuries ago is because of that belief. You have to do that because you're taking care of Christ. Then the people inside the institution would also hold that religious belief. So you're on the same team, right? Right now, in many places, you're not on the same team. They have their own world, and usually this world doesn't really place a lot of importance to you and what you do. Or you might actually even have this curious situation where the healthcare or the medical providers inside, in their mind, when it comes to sick and dying, God works through them, and you're only good for the spiritual stuff, which is also very strange. Because for one thing, their science and attitudes are approach that's extremely non-religious and very secular. And yet they try to convince themselves that God works through them. Something that's based on the idea of no God or God doesn't interfere. It's also the medium or way by which God helps people or heals people. I mean, it's very confusing, but actually the reason why we think that way is because, God works through us and this is our science, it's secular, but, we don't really think about it so that we don't get confused. We just swallow the entire thing. It might be a psychological defense mechanism for doctors. If you actually think about it, it sounds very stupid and ignorant. It doesn't make any sense, but, that's the way it is. And the reason why I'm telling this to you is because you, as the spiritual care provider, the pastor, the priest, or the nun, shouldn't think that way. Okay? I mean, it's not the hospital or the doctors or the care providers or the professionals inside that place. It's the person asking for you and the family who's asking for you who needs your help. Now, since we talked about the chapters in the book, briefly, what I can tell you, since you're probably going to Google it up and look at what chapters or what the knowledge base is. Well, the knowledge base of modern medicine has changed since the 20th century when we discovered that we can actually cure certain things, and we try to convince ourselves that we can cure a lot of things, which is only partly true. And part of it is just marketing gimmick. Unfortunately, the trainees also are brainwashed to think that we can cure so many stuff. But anyway, that's another topic. Then the attitudes and the values inside the medical institutions and the modern medical care provider communities also changed. At first, someone is experiencing a lot of these distressing symptoms and concerns and emotional problems, and then we sort of care for them and make it better. Now, the idea is, well, we have to define the problem or the disease, and these symptoms are clues so that we can come up with a proper label. Now, once we know the proper label, then we look at our science and our clinical trials, which has nothing to do with religion, because, there's this big idea of large, huge, randomized controlled trials. So we came up with statistics and probability. Well, first, the question is, how can you figure out what to do when you're dealing with a problem that's so complex and you're dealing with something experiencing that problem who are just as complex like a human being? Well, you use statistics and probability. You get a whole bunch of them and you take out all the complexity. Like, some of them are Christian, some of them are atheists, some of them are, it doesn't really matter. So you kind of get a whole bunch of them, and then you do something like you make them swallow a sugar pill, and then you make the other group swallow a chemical or a drug or whatnot, and then if they get better, then it works, regardless of what you believe in. So the idea of God healing you gets taken out of the equation. That's part of the reason why the medical community and the institutions are becoming more and more non-religious and secular, because they don't think they need God. And that's also the reason why doctors, especially the ones in the universities who think they're very scholarly, are actually atheists or agnostics, or some of them actually, they have this God jokes, like, the punchline is, we think we're God. Anyway, I won't give you those jokes. You can just Google them for yourselves. So now the attention is for cure. We can cure everything. We have godlike powers, which is not true. But and so we don't really care about all these symptoms and causes of distress. They're just clues. Once we define it and we come up with an intervention, and that's pretty much the end of the story. So what I'm saying is the attitude and the values shifted from care to cure. Now, the beginning young pastor or nun and priest in training would also grow up in that kind of environment. The most important thing in the world is for the doctors to find the cure, and then you kind of pray so that God will work through this. Doctors who probably don't believe in God or don't believe that God has anything to do with their science, and hopefully he'll find a cure, even if his science doesn't really provide a lot of cure to most of the diseases, even though he thinks it does. So that's the reason why people are miserable and suffering inside. And then you say, well, what about the caring part? Because that's the idea. You're a pastor, they're suffering, they're miserable. You don't just pray so that the doctors will make it go away. You want to go there and talk to them. And usually it's extreme misery and suffering goes along with questions about faith and beliefs and religion and spiritual distress. And it also allows your very spiritual, religion-based interventions to work a whole lot, right? So that's the reason why in places where they still allow the religious groups to go around and visit and take a lot of time with the patients actually get better a lot more quickly. They feel better, and actually the quality of their remaining life, even if they don't really live too long, improves a lot. But then the problem is, that's a religious thing, and nobody wants to be religious. Everyone wants to be secular. So again, the bottom line, when someone is in the hospital or someone's very sick in whatever medical place or institution they're in, regardless of what the doctors or the other modern medical care providers are telling you, know what you're supposed to be doing. And again, those who are very miserable, especially those who are poor, suffering, especially those who are dying, the least of my brethren, or the least of your brethren, you do unto Christ. You don't do anything, then that means you don't do anything for Christ, right? So you just pray, when in fact you pray plus you have to be doing something. Then you have to do something. The doctor said this, we cannot do this. The hospital said this, the policy is this. That is no excuse, right? And of course, you also have to empower the family and the patient so that if ever they end up in that kind of place or environment, they'll fight for your right to be with them, or so that you can actually care for them, give them the care that they really need.